I want you to do is I want you to pinch your nose like this, okay? And then bob your head, close your lips, bob your head like this until the second you're hungry for air, let go. Hello, welcome back to Presential Dental Holistic Dentistry. I'm Dr. Ariane. In my practice, we found a lot of patients has problem breathing to their nose. Maybe all the way from children all the way to adulthood. Maybe you, as you speak right now, maybe you a lot of, and the thing is like this: a lot of our patients didn't realize they breathe to their mouth, and then no, I don't breathe, and this is really not derogatory term at all, mouth breather, okay? Because this is relating to your overall health as well. A lot of my patients, they say, oh, I don't breathe to my mouth, doc. I said, well, there's signs that you may breathe to your mouth. Number one, your mouth is dry. Number two, there's a crack on your lips. And then I noticed that, patients keep wetting their lips as well. Those are the, and then also their, sometimes their voice is hoarse a little bit, and or their tongue is become really red and dry and cracked. So those are actually some of the signs of dry mouth that happen because of mouth breathing, and a lot of time they mouth breathe because their nose is plugged. So today I would like to talk about nasal hygiene. We understand that there is oral hygiene, but there is also nasal hygiene that can help improve your oral hygiene. Okay. Number one, what I want you to do is number one, try to close one of your nostril like this, and then breathe. Okay, and then go on the other side, and then breathe. And then go on both sides, okay? And then you can compare if there is any stuffiness in one or both of your nostril. If that's what happened, it's very imperative that you make sure before you go to sleep that you clear up your nose. Of course, you have to talk to your ENT if there is any underlying issues. But for the rest of us that happen to have, especially during this high allergy season, it's very important that we pay attention to this nose, okay, to prevent dry mouth and mouth breathing. Okay, so after you finish closing your nose and you notice that there is plug in there, so what you want to do is you want to take for children, maybe if they start doing this nasal hygiene program, we can use something called Xlear. I'll give you the information in the bottom. Xlear, you can get it. I love Xlear because it's all natural, has xylitol in it, and xylitol has natural antibacterial effects. Okay, so you want to put the bottle perpendicular, horizontal like this, and then you just put 1, 2, and then 1, 2. Okay, and then after that, I want you to do is I want you to pinch your nose like this. Okay, and then bob your head, close your lips, bob your head like this until the second you're hungry for air, let go. You don't want to hold your breath, okay? So the second you feel hunger, then you release that. And then what happens is as you bob your head and then hold your breath, there is nitric oxide production, in your sinuses and also your paranasal sinuses. This nitric oxide is a molecule that actually help to open up the blood vessels. When the blood vessel opened up, that means there's more blood coming into the area, along with all of the immune cells that take out, if there's any bacteria or any virus or anything like that. So it's a natural way to clear up your nose, basically. So you do this, okay, bump your head, and then a lot of my patients, they're surprised once they do this. They get ready, with the tissue, so you can blow your nose, okay, and then you repeat that for 10 times to make sure that all of the junks come out of your nose. And then after that, for the one that already trained, get used to this medication getting inside your nose. There's also another one that I like to do for somebody that have more severe nasal blockage, called sinus med. I'm going to give you information also in the bottom. So this sinus med, basically there's a little bottle right here, and then you little bottle, you mix with the make sure that the water is the clean water, um, filter water. Okay, you don't want to have tap water because we don't want to have any bacteria that maybe exists, in the tap water. Okay, so filter water, okay, or distilled water, and then you mix the package with the water in the inside the bottle. Okay, and then mix it properly, and then you lean your head toward the sink, and then put one of the nozzle inside like this, and then put your head a little bit backward like this, and then squeeze it. Close your nose, squeeze it, and make sure you don't breathe. Okay, and then the water will come out, to the other side of the nose, and then you go the other side again. Okay, close your nose, lean back, and squeeze it, and then it will gently come out and clear up your nose. You will find out how amazing it is to be able to breathe to your nose clearly like that. Okay, now after that, make sure that you clean up, with the tissue, and then that's the nasal hygiene. Now, a lot of my patients also, I suggest that after they used to this, and then some other thing that we recommend in the clinic is actually to tape the mouth. Okay, there are several mouth tape that I recommend. Also, I'm going to give you the information down below. And so make sure that when we tape our mouth, we make sure when we're sleeping and your nose is clear, that you're not out of habit, maybe open up your mouth and breathe to the mouth again. Okay, now breathing to the mouth is not good. Why? Because there is no filtration going on. While if you breathe to the nose has a mechanism to clear up all of these bacteria, virus, fungus, mites, and dust, and all that. While if you breathe to the mouth, that means you breathe all of these allergens, all of these foreign objects, to your lungs, and your lungs become stuffy, and then it's become congested, and you wind up, getting more allergies, sinus issues, breathing issues, and all that. So please come see us if you need to see if you are mouth breathing or not, and then how we can help you to customize the plan. So hopefully you can be a good nasal breather. Hopefully this helped. And then please come to our place, Presidential Holistic Dentistry. Our phone number is 610-664-1641. Thank you.